An AI just diagnosed cancer more accurately than the world's best radiologists. And that's the scariest part. Not because it's wrong, because it's right. And because almost nobody is ready for what comes next. Let me back up. A few weeks ago, a group of researchers tested GPT-5 Pro on something called the ImageNet medical dataset. They fed it thousands of CT scans and pathology images of actual tumors. Real cancer, real stakes. And when they checked the results, GPT-5 Pro caught cancers that radiologists missed. Not by a little, by enough that in a hospital setting, those would have been lives saved. That's not hype. That's a peer-reviewed finding. Now, you might think doctors would be celebrating, but they're not. And the reason reveals something fundamental about how AI is about to remake medicine, and why that terrifies the people actually holding the stethoscopes. First, let's talk about what's actually happening here. Radiologists are trained for years, decades sometimes. They develop what you might call intuition, but it's really pattern recognition built on thousands and thousands of images burned into their brain. A shadow that's slightly too dense, a border that's too irregular, a texture that doesn't belong. They see it. Their brain flags it. They call it cancer. An AI model like GPT-5 Pro does something similar, but different. It's trained on millions of images, not thousands. It doesn't get tired. It doesn't have a bad day. It doesn't miss the scan at 4:30 in the afternoon because it's been staring at screens for 12 hours straight. And because it's a large language model, it can also read the patient's history, the notes, the lab results, and connect dots that a radiologist looking only at the image might not see. So far, that sounds like a win. Better diagnosis, faster detection, fewer missed cases. And it is. But here's where it gets complicated. Doctors are terrified for three concrete reasons. First, liability and trust. If an AI catches a cancer and a radiologist doesn't, who's responsible? Is the radiologist liable for missing it? Does the hospital get sued? Right now, the law is murky. The regulations don't exist yet. A radiologist could do their job perfectly and still be blamed because the AI saw something they didn't. That's not just scary for doctors. It changes how they practice. Second, the replacement question. If GPT-5 Pro can read scans better than a radiologist, why hire radiologists? Hospitals are already cutting costs everywhere. This is the kind of thing that looks to a bean counter like an obvious efficiency play. You don't need a 50-year-old radiologist making $200,000 a year when a $100 a month AI subscription can do the job better and never takes a vacation. That's not paranoia. That's basic economics. And it's already happening in some places. Third, and this is the deepest fear, it's about agency and understanding. A radiologist can explain why they think something is cancer. They can point to the scan, show you the findings, talk you through the reasoning. You can push back. You can ask questions. You can say, I don't feel comfortable with that diagnosis. Let's get a second opinion. With an AI, that becomes much harder. Ask GPT-5 Pro why it flagged a tumor, and it can give you an explanation, sure. But it's not the same as a human expert walking you through their thought process. It's more like a black box that says, trust me, it's cancer. And that breaks something fundamental about the doctor-patient relationship. But here's what's actually wild. None of this stops what's coming. This is not a hypothetical. This is happening right now. Hospitals in Singapore, South Korea, and parts of Europe are already deploying AI diagnostic tools in radiology departments. Not replacing radiologists yet, but augmenting them. The AI flags things. The radiologist confirms or disputes. And slowly, the radiologist's job becomes less find the cancer and more verify what the AI found. That's a different job. It pays less. It's less prestigious. And it changes who wants to become a radiologist. The real terror isn't that AI will be bad at medicine. It's that AI will be good at it. Good enough that the economics of healthcare force a reckoning. Good enough that entire categories of expertise become less valuable. Good enough that we have to completely rethink how we train doctors, how we structure medical practice, and who gets to make decisions about your health. And there's a second-order effect that almost nobody talks about. If AI can read cancer scans better than doctors, what else can it do better? Diagnose heart disease from EKGs. Read mammograms. Interpret blood work. Spot early signs of Alzheimer's on brain scans. Every single one of those is a specialty. Every single one is a job. Every single one is about to be disrupted. So what actually happens? My guess. and this is educated speculation based on what's already happening in tech, is a split. In rich countries with strong medical boards and regulations, you'll see a hybrid model emerge. AI does the heavy lifting. Radiologists become more like quality control and complex case specialists. It's not a great outcome for radiologists, but it's not unemployment either. In poorer countries, or places with doctor shortages, AI might actually save lives by providing diagnosis where there was none before. But the transition is going to be messy. People will lose jobs. Standards will vary. Some AIs will be better than others, and patients won't always know which they're getting. And there will be cases, there always are, where the AI misses something or catches something that isn't really there, and someone gets hurt. The thing that should actually scare you isn't that GPT-5 Pro is better at reading cancer scans. It's that we're not ready for what that means. We don't have the regulations. We don't have the ethical frameworks. We don't have agreement on who's liable when things go wrong. We're deploying this technology because we can, not because we've figured out how to do it right. And that's the story nobody's telling you. The AI works. That's the problem. If you want to actually understand how AI is reshaping medicine and every other field before it hits you personally, subscribe. I break down one of these shifts every few days, and most people don't see it coming until it's already changed their job or their health or their future. Hit that button, and I'll see you in the next one.